Asteroid of fear.
Hey everyone, welcome to another episode of the Men of the House podcast, and I am super excited. Today, we are going to talk with Brett Cordis, and he is a physician slash surgeon, physician coach, and as everybody knows, I have a healthcare background, so we're going to be speaking the same language. But also, we'll get to kind of highlight the truth versus reality of I think what it's like to work in healthcare, because it is very rewarding, and we all come into it from a place of heart and service. I do believe. Maybe some people go in strictly for money, but insecurity. But I think it at some point that service and care for others, um, we forget to care for ourselves, and somewhere down the road, we burn out, and healthcare will take everything from you. And we have to go back and almost become the patient, treat ourselves, heal, recover, so that we can serve others. And I think as a society and the medical system profession as a whole, um, we got to get better at figuring out how to relieve some of that pressure along the way, so we can have longevity and so we're not facing burnout, which is a huge topic. But thank you for joining me today. Um,
Absolutely. Thanks for having me.
yes. So let's talk about becoming a physician. Where did you grow up, and was this what you always wanted to do, or how did you, at what point did you decide like, hey, I want to be a doctor? Were you an athlete? Did you explore sports? Were you strictly like a cerebral type child?
Yeah. So I grew up in Baton Rouge, Louisiana.
Okay.
Um, let's see, I'm 48 years old, so I was born in 1977. And I had a fairly normal childhood. To answer your question, yes, I was heavily involved in sports growing up. My dad played college basketball and played pretty much every sport there was in high school. So I did the same. I'll say I was really good at most sports, but I wasn't excellent at any one sport.
Okay.
Although basketball and I ran track too, those were my favorite. Um, but I will say, and this will play into part of addiction as the disease later on, but essentially, um, I thought that anything I ever did had to be perfect or excellent. And that's because that's what my parents modeled. Like my dad he's a life master bridge player, and he's a PhD mathematician and
Mm.
teaches or used to teach it in college at LSU. My mom is the same, but with English. My sister was salutatorian of her high school and is an attorney. So accomplishment began to equate with my own self-worth. And so
Yeah.
I mention that right now because that's going to play a major role later on when
I
we
have
start.
the same I have the same issue because I was telling my business coach, I had like a little mini meltdown, and uh, I got grounded for an 88 in geometry once. And I was
Mm,
like, this is what happens when you raise an OCD, people pleasing perfectionist, is that I'm 49, and it started to surface in my 40s.
yeah,
Well, the understanding how this played into my alcoholism and whatnot.
yeah. It's funny you said that because I got in trouble for getting an 86 on a science test.
Huh.
But interesting. But really, I mean, and I do want to say that my parents never told me straight up, "Hey, everything you have to do needs to be perfect or excellent." They never said anything like that. I just kind of misinterpreted their accomplishments as that.
Well, you
Uh,
get praise from it, and you get validation from it, and that becomes, oh, I'm a good child. Like I'm doing good.
yeah, you're exactly right. Yeah. Um, To answer another question, no, I had no idea or no inclination about becoming a physician when I was growing up. There were no healthcare workers in my either immediate or extended family. No nurses or doctors or therapists or anything. We had either academicians or attorneys. So we
Okay.
did have a heavily academic household. Academics were a priority, but not because of healthcare. My mom did say, and she used to say this all the time, that she thought I'd be a good doctor because I had a good smile. So I don't know how relevant that is. Um,
It's
but
important.
yeah. And so I went to LSU, which was, I grew up in Baton Rouge. So I went to Louisiana State University. And at the tail end of my freshman year, I made majoring in history just because I like history.
Right.
Um, and I liked science. So I was taking some science classes, but I did not really know what I wanted to do with my life. I knew I did not want to go to law school. Um, but in March of my freshman year at LSU, I was diagnosed with non-Hodgkin's lymphoma.
Mm.
Um, and then so I ended up having to battle this cancer diagnosis. All in all, it was 16 months because it recurred shortly after I had the first treatment
And
for it. So
did you continue in your college education while you were receiving treatment?
yes, so I the first semester that I had when I was receiving treatment, I finished out, and then I had to drop down to 6 hours in my
Okay.
second semester. But the third semester, I had to take completely off because I ended up having a stem cell transplant in Houston at MD Anderson, and so I couldn't continue. But yeah, I
What was it?
graduated in.
What was that? I don't want to gloss over it too much, but what what was that experience like at a young age of did you like facing mortality, the possibility? What did they tell you and how did you process it? Did they tell
Yeah,
you like you can
so
die?
I to answer your question, I was in 1,000% denial the first go round.
Okay.
So the first go round, they gave me like an 88% survival at 5 years, which it never even entered my mind that I wouldn't survive. And so I was in complete denial. And so I did 4.5 months of chemotherapy. I was halfway through with my radiation when it came back. And then they quoted me a 60% survival. And so that got my attention. And yes, I was petrified. I went from, an invincible teenager to just like you said, a 19-year-old that's staring at his own mortality in the face. It was a extremely humbling experience.
Did different things become important to you at that moment? And what do you distinctly remember going, um, I'm from the South, I'm from Texas. And we so I know Louisiana very well and the the religious aspect of it.
Yeah.
And so yeah, did I don't know, did it change like anything like that? The behavior.
Well, yeah. So one thing that became extremely important to me was my physical health.
Okay.
Uh, and so any sort of diet, exercise, anything from a physical health standpoint, I really lined up as a priority after that. I was raised Catholic
Okay.
and, I went to church every Sunday, but I definitely was not a very religious person per se.
Mm-hmm.
And so I will say that I think my relationship with, religion strengthened a little bit. But interestingly, it did the opposite to my mom. My mom, who was always a staunch Catholic her entire life, she became an atheist after my experience. So I think it's very interesting that some people are pulled toward and some people are pushed away that element of things.
Wow. Interesting. Hmm.
Yeah. And so here I am. It's now the fall of 1996, and so I switched all my classes, and I still am majoring in history, but I'm planning on taking all the prerequisites to go to med school.
Mm-hmm.
And yeah, I mean, my cancer experience directly led to my becoming a doctor.
And what was it about it? Did you have an interaction with a physician, staff? Was there any one person that was kind of like, you're like, this is it, this is what I want to do? Or was it kind of like this general, because we talk about whether you bring in a religious aspect or something, a servitude of going. Um, I feel maybe lucky to have survived this, and I feel like I owe to help other people survive it too.
100%. Yeah, I definitely had some pretty good survival guilt going on. At the time, I had an autologous stem cell transplant, so they harvested my stem cells and then gave them back to me during the transplant, which at the time was experimental. So
Right.
in the experimental arm of the study that I was in, there were 10 people, only two of us survived. So um, yes, I definitely wanted to pay it forward, so to speak, for the rest of my life. In service to others. But really, what drove me is that I had several physicians, some at MD Anderson, some and not. And there were two in particular. My main lymphoma doctor was phenomenal. He had an extremely good bedside manner, very caring, lots of empathy. We loved him. My dad actually wrote him a letter after we were all said and done, telling him, how much we thought of him. And my transplant doctor was uh, had no bedside manner whatsoever, but was an excellent researcher and clinician.
Right.
And so I'm thinking to myself, gosh, I think I can do both of these things. I think I can both be a good doctor from an X's and O's standpoint, but with the empathy and caring to go along with it. So kind of both of those aspects, the guilt for service and thinking I could do it a little bit better were the main reasons.
Yeah. And how was the so you gear all your classes towards that. You come from an academic background, so I'm certain the MCAT, just another standardized test, like the pre-law type of thing. You were going to take one anyway of some sort. But how was the medical school experience? Did you go to school at LSU or did you come to Texas? Where'd you go to school and how was that experience?
Yeah, I went to LSU School of Medicine in New Orleans. There's two
Okay.
of them, one in New Orleans and one in Shreveport. And so, um, really, I started performing well in school for myself
Hmm.
at the tail end of my high school career. So prior to that, I would get A's just because that's what my parents expected.
Right.
And so, I really started to become internally motivated to do my best in academics at the tail end of my high school. And so when I graduated college and was going to med school, this was me in spades. So I studied an enormous amount and wanted to do as well as humanly possible in med school. And I didn't want to look back and think to myself, "Gosh, I wish I could have done this specialty or this specialty." But those first couple of years, I didn't get good enough grades or whatnot. So I jumped in with both feet, and I was hardcore medical student. But I enjoyed it. We had block tests, so every 6 or 7 weeks you would have a test in every subject, and so you could relax a little bit for the 1 or 2 weeks after that
Hmm.
before you started gearing up. But yeah, I enjoyed med school. I met a lot of really good friends there.
Yeah. I think I enjoy I enjoy the education process too. There's so much debate now about the value of education and whatnot. But like for me, having a master's with a 1 year old as a manager, I'm like, it shows you what you're capable of. But then, I think it for people in certain things, I mean, some people have it naturally, but you kind of learn a method in a way to when you want to try something new. Hey, I did this in school. There's a syllabus and there's plans, and you can kind of, you know, create your own structure if you want to be entrepreneurial. It does offer some valid stuff along with the connection and social stuff.
Yeah, that's interesting because building the business that I've built as a physician coach, it's somewhat entrepreneurial, and I've always considered myself an absolutely terrible entrepreneur because I'm so risk averse.
Yeah.
I don't want to do anything if it involves any sort of risk, and so I'm very conservative and I've never felt like my brain works in that creative way, so to speak.
Yeah.
But who knows?
So when you're so in school, so most people you go to medical school and then some people automatically they're like, they know they want to be a surgeon. Like for me, if I were going into medicine, I 100% it was going to be emergency medicine or trauma surgery, period. I didn't really care for anything else. But how did you, some is by grades, position in class, openings, matching. There is a whole bunch of stuff that goes into kind of where you could potentially end up. What were your favorite things um, as a student and in kind of your maybe intern year when you start stuff, and where did you think you were going versus where you ended up?
Yeah, so when I started medical school, I thought for sure I was going to do emergency medicine. And the show ER was on at the time, which
And you're
actually,
in New Orleans, which is a high trauma area. You get to see like I was downtown Austin and I knew New Orleans. We had doctors that trained there in New Orleans and they were like, yeah, it's the real deal.
yeah, it's the real deal. And so I started a 4-year research project centered around emergency medicine. And for the first 2 years of school, which are in the classroom, you don't really
Hmm.
go out. It was all pointed toward emergency medicine. And then like 7 or 8 days into my very first rotation, third year, which was trauma surgery, it was pretty obvious that my personality meshed with the other surgeons. And so, and it's different for everyone, but it's pretty common in medical school to you're drawn toward the specialty that you mesh with the people that are in that specialty. And so that happened for me with surgery, but I had the wherewithal to know that I didn't want to work 80, 90 hours a week.
Right.
I didn't want to be an absentee father because I was working so much. And so, ear, nose, and throat, ENT was my very last 2 weeks of surgery, and it was just perfect. It had the best of both worlds. I can be a clinic doctor 85% of the time, and then
Hmm.
50% of the time I can be a surgeon. And so, even a busy ENT doctor only works maybe 55 hours a week. Um, so it was perfect. So that's how I got
Ended
into
up with that. Yeah,
ENT.
that is interesting. I see that, because it is very much like, I worked six 6 years in a level one trauma center, and that was my second time working in an ER. And it is very, I've worked in kitchens and I've been in the military. They're all very similar. We eat our own. Um, Everything is hierarchical based on performance. And if you cannot do the job, they'll let you know real quick. And you do, like you said, you mesh with those people. But um, I think anybody interested in going into medicine is that's kind of one of the considerations you have to think of. As a lot of people choose ER because it is shift work. But if you're going to do that, you have to consider, hey, do you want to be taking call? And working when I was at a level one trauma center, that means we have all the specialties. And so whether it's ENT, oral maxillofacial, whatever, um, they're on call and you have to be willing to do that. And I think, one of the key things for longevity is finding that sweet spot, like you said, because some people forget about the other part of life of like, hey, I got to be a dad and a husband and all that too. And that takes time. And the medical field is, um, time is not friendly.
Right. And you had asked me previously what was kind of my favorite aspects of medical school and what was my least favorite aspects.
Hmm.
And I liked the one-to-one correlation with, the more work you put into it, the better the results.
Right.
It was a mystery how to do well in school. And so, and because, my self-worth was or had been tied to my achievements, I did very well in medical school. And so that led to me working even harder, and I wanted to make sure that my grades were excellent so that I would have every specialty at
Choice.
least option.
Yeah.
Yeah. But my least favorite aspect of it was exactly what you mentioned, which was this extremely competitive, hierarchical kind of subculture that is not just medical school, but all of healthcare or medicine.
Hmm.
At least that's been my experience. And so I got, even in med school, I got burned out on the competitiveness of it. And so I remembered that when it came time to finishing residency, I didn't want to be an academic doctor because I was just so sick of having to do things I didn't want to do, like research and grants. And that just wasn't, I didn't sign up for that.
Well, and not only that though, it seems like I don't know. I could be wrong. I mean, there are good clinicians and researchers, but sometimes the people with the shitty bedside manner are the people stuck in the lab doing the research, and then the competitiveness within that because it's research and papers and studies and money and funding. It's this whole other world of kind of competitiveness in medicine that you don't see unless you're in that environment, I
Mhm.
guess. But
Yeah.
it is interesting that it could go either way. And I've only seen a few that were kind of the both. I think I remember like hearing one MD PhD student. He was a resident and he was in there with the tono pen telling this other intern that his grandfather or something invented the tono pen or something. I don't know. It was like you see and hear some interesting things of like, seeing a resident, you see somebody who's deaf, communication by hand, and the resident's just talking louder, and I'm like, that's not going to help. And or seeing residents in the resident room, and you call them because you need orders, and they look at the phone like they've never seen a phone before. But it's a lot of fun, and I loved working with residents and seeing and talking to them about their journeys and people who have like, what is it, like a transition year if they're going to go into a different specialty and learning how all that worked. And it's been, I saw them as a senior clerk as residents, and then I go into management and they finish their residency and now they're doctors. And one of the guys who was on the trauma service, he ended up becoming a trauma surgeon at the hospital in my town. So I was like, holy cow. And his wife, who was a doctor, ended up working for the group I worked for. And so yeah, it's it's fun to connect the dots and all that. But so you choose ENT, and
Yeah.
um is that a whole different residency, or how does the specialization work in that
Yeah.
type of thing?
So, ENT is considered one of those surgical subspecialties. So, neurosurgery is a surgical subspecialty.
So you did a
Orthopedic,
surgery residency and then something else, right?
I did 1 year of general surgery.
Okay.
So one internship of general surgery, and then 4 years of ENT.
Okay.
And so, yeah, most people don't really, they don't think about it because they don't need to. But an ear, nose, and throat surgeon, we operate on maybe 10% of our patients. So the vast majority of our patients we're treating with antibiotics or sinus infections and allergies and ear infections and sore throats and stuff like that. So 90% of our patients don't see the operating room, which again, like I said, which is perfect because a busy ENT might generate 1 full day of operating per week, and that's a busy ENT doctor. Some people only have a half a day of operating per week. So it really is a nice split, a nice combination of a clinic doctor and a surgeon. So,
Well, when you finished residency, where did you launch into the world? Because isn't that the most exciting part is like, you go from it's like high school, you're freshman, graduate, undergrad, freshman, graduate, bottom to top, medical school, bottom to top, residency, bottom to top. You're finally you're gonna join a group, join a hospital. You're at the bottom, but you're in a place where you're finally maybe gonna start making some real money. Where do you end up and how does that go? What was your sentiment about it? Did you get that excitement of like, finally, I'm arriving. I'm going to make some real money. The pressure's going to be off a little bit.
oh, for sure. Yeah. And, backing up a little bit, I love residency more than I liked medical school
Hmm.
because again, I liked the praise for achievements. I liked the fact that the more you worked, the better
Yeah.
it went for you.
And it's
But
a badge of honor in that environment.
yeah, and so but the competitiveness was something that I really was getting sick of, and I'll equate it. It's a little bit like for anyone who has a child in competitive sports. It's a little bit like having a child in competitive baseball or volleyball or something over the summer, where you have kids that have to try out for a team, and someone put it so perfectly. They said everyone wants everyone else's kid to do well, just not as well as their kid.
Mm,
And so there is a very uh, biting, toxic undertone to the culture that is competitive kids sports, and it's very, very similar to residency. And so I just did not want any part of that anymore. So I didn't want to do academics. So I knew I wanted to do private practice. And it just so happened that one of the private practices that we rotated with inside the medical center offered me a job. And so that's how I ended up in private practice at this specific practice. It was right across the street from Methodist Hospital. So I didn't even have to move. It was perfect.
man. Yeah,
Yeah.
so and so I guess people unfamiliar with that is typically you might have some offices or whatnot, and then you have like what surgical privileges where when you need to take your people to the operating room, you would do the hospital, they get to stay there, receive the care there, and then you can round on them. But um were you guys actually part of Methodist, or usually it's like I know the group I worked for, it's like the clinician group is kind of its own separate thing, and the hospital kind of pays, I think, them on kind of like a back end because I think there's laws like you can't directly employ physicians and whatnot. And
Yeah. So we were our office was inside the St. Luke's Hospital
okay.
office. And so we weren't employed by St. Luke's or Methodist, but I had surgical privileges at both St. Luke's and Methodist and also Texas Children's. But we had an unofficial tie with St. Luke's. So we were kind of the group that people use for any sort of
Mhm.
consult, whether it's an emergency room consult or a hospital consult. So I was seeing consults in the hospital for our group as well, at St. Luke's at least.
Did you have any, you mentioned pediatrics. Did that require any, was that included in the training and part of the residency, or was there anything separate with that? Because I know some people, when they do peds, like we had Dell Children's. So a lot of times if it was level, we auto to Dell, and some things are strictly peds. How was that? Because I never really did. I don't know that I met like, does ENT have specific for peds, like strictly peds ENT, or is it always kind of both?
Yeah, so yes, there is a fellowship after your 5 years of ENT training for pediatrics, which is another year.
Oh, okay.
But a normal ENT doctor is going to be sufficiently trained to do
Hmm.
tubes and tonsils and basic stuff for kids, what I call bread and butter pediatrics. And so you didn't need a fellowship or extra training for that.
Yeah, usually it's one of those. I know you see it sometimes like with hand surgeons and stuff. We would always have that um, because they would always go do, or maybe as a oral max reconstruction, like cleft palate,
Mm.
cleft lip, and whatnot. And they would do a lot of missionary work. And we had quite a few surgeons who would do that kind of stuff for free, um, and a lot strictly with pediatrics. And so, yeah, I know that sometimes that requires a whole different level. But so you get into practice. Um, Life is going. Are you married? Have kids? Give us an idea of kind of what life looks like as a doctor joining the group, what's going on, and where we start getting into substance abuse or coping. You know, because it's like, hey, are you married with kids and it's normal? We have some wine every night, or how does this all happen? What does life look like at this point? Because it should be good. You're finishing everything, launching into life of your career to serve people.
Yeah. And it was good. I was when I graduated residency and started as a private practice doctor. I received my first real paycheck of my entire life when I was 32.
Wow.
Uh, so you had mentioned something about that before, and that's pretty crazy to think of.
Mm-hmm.
But I think when I graduated residency, my kids were maybe 7 and 5,
Okay.
um, something like that, and it it met or exceeded all of my expectations. It was phenomenal. I was working very hard, but again, for ENT, that's only about 50 hours a week. And I built my practice up so quickly that it took me about 14 months to be 100% booked up
That's good.
from a doctor standpoint. And my coworkers and my partners were extremely good to me, very almost too fair. They would let me see all their leftover patients or overflow patients.
Mm-hmm.
So that's not always the case. In fact, rarely is that the case. So because they were so good to me, I was able to build my practice up quickly. And it was awesome. I mean, I loved my job. My wife and I loved the suburb that we were living in, kids in school and sports, and I was coaching a lot of their sports teams, and we were involved with our church in the suburb we were living at the time. My wife was involved with all kind of environmental stuff. I mean, we were loved the community. Everything was what I would say is perfect. And so the question is, well, if everything's so perfect, how did you end up becoming an opiate addict? And so the answer is after about year 6, maybe 5 or 6, I started to feel what I thought was boredom. I started to become kind of bored. And now, looking back on it, I now know that what I was actually feeling was a lack of fulfillment. But at the time, I thought I was getting bored. And the reason for that is because my entire life, I was starting over at the bottom, working myself to the top, bottom, top. So I've been climbing a mountain my entire life. And so you think at this point in time, I would just relax and look around and be able to take it all in, all the success and achievement over the years. But I didn't once do that. The only thing I could think of was, okay, what's the next challenge? What's the next challenge? What can I dive into, start at the bottom and work my way to the top?
Oh
Because
boy, and did you get it?
yeah, and
Be
and
careful
again,
what you ask for.
looking back on it, I didn't know this at the time, but I loved the process.
Yeah.
I've always loved climbing the mountain,
I'm
getting.
similar. I'm similar because I used to always say from a very young age, I've had this idea of like, you could have the best wife, best kids, best life, whatever. It can all be gone in a day. You need to wake up and be okay with you. But also, is in society, we've been taught climb, 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 climb. What happens if you never reach the top? You may never reach the top. You may die in an accident somewhere here and you forgot to even pause and look around at the rung that you're on. And then also, like you said, when you get to the top, it's like, well, now what?
Yeah, yeah, and so I would, I was getting bored, so I started like inventing conflicts or inventing things for me to work at, and a lot of them were athletic stuff, like you know training to run a 40-yard dash or training to kick a field goal or
Hmm.
dunk a basketball. These are things that I could train for 6 or 8 months and then hopefully reach that goal. That's the kind of stuff I was doing because, and again, I didn't know this at the time, but what I was chasing was the dopamine. I was chasing the dopamine hit that I used to get from my parents when I brought home an A.
And
And
also, well, in school, I mean, the
yeah,
whole environment you were in is perpetually that way because you're constantly being graded. I mean, whether it's you're attending, asking the group of 10 people what they think it is and who gets it right and who doesn't. I mean, you're getting instant dopamine or not on a regular basis. It's
yeah,
very
that's exactly right.
instantaneous.
Yeah. So I stopped receiving all the that boys, that I had gotten all my life. And so again, because my self-worth at the time is tied to being told, hey, you're doing a good job, when those things went quiet, I was left with myself. And again, at the time, I didn't have inherent self-worth. So I thought I was bored. I had a lack of fulfillment, and through that grew a little bit of kind of an anxiety, depression sort of thing. And ultimately, that's what led to the substance abuse. And so the way that that looked was my general Friday afternoon schedule would I would get out of work around 2:30, drive home, and my wife and I would have a couple of beers and sit out by the pool and enjoy the beginning of the weekend.
Right.
And so one random Friday afternoon, before I left from work, a drug rep had brought by some cough medicine samples that were hydrocodone based.
Mm-hmm.
And my first introduction to opiates was back when I was 19, and being treated for cancer. Lymphoma wasn't a real painful cancer for me because it didn't go to the bones, but I had several surgical biopsies and little minor things there that I needed to be prescribed pain medication. And at the time, when I was 19, I liked the way the opiates felt. They were like two or three beers.
Right.
But it wasn't earth shattering. It was nothing to write home about. Like, it never occurred to me to take a pain pill just for the buzz that it gave me. That just never crossed my mind. And so when I saw these cough medicine samples, I'm thinking to myself, oh, I know how hydrocodone makes me feel. It's, you know what? I'm going to take one of these samples home this afternoon, and instead of drinking a couple of Bud Light limes, I'm just going to have this cough medicine
Well,
sample.
let's reference it. For Houston, you were like, I'm gonna make some syrup. You're like, I'm gonna do a 7 Up and a cough medicine sample, and yeah, break open the Cadillac and hit the road instead of a couple of beers. That's actually more of a joke, more of a Houston thing. If people know Houston rap, which is very famous, and they're very big on lean, which is like a codeine syrup poured in Sprite or something, and it tastes, I guess, like Kool-Aid or something, but um, it is a big known thing in the rap culture. And so while I make a joke about it, it, recovery is a serious thing, and we're here to talk about it seriously. But my wife's from the Woodlands, and as a shout out to the Dirty Dirty, which is what I call it, that's what I thought of.
Yeah. Well, yeah. And so the difference this time is, I had a big void
Hmm.
that I didn't know how to fill. And when I took that cough medicine sample, um, again, I'm about 37 years old at this point. It was the euphoric feeling that you may or may not have heard about. It was by far the most euphoric, best feeling I'd ever felt in my entire life. And all of my problems, at least in my head, all of my problems were solved. And I had found the magic medication because I didn't seem to have any negative side effects or consequences from it. Opiates for me, they don't make me sleepy. They make me energetic.
I'm the
And
same way.
yeah, they
I feel
improve.
like they focus me.
Yeah. So energetic, focus, it feels good. Problems go away. And so, but I was a responsible addict in the beginning, which is to say, it took me 2 years, a full 2 years from the time I took that first cough medicine sample to the time where I was taking opiates daily to avoid the withdrawal symptoms. And so I've ramped up very, 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 very slowly. And so at the 2 year mark, I had not experienced any negative consequences. So,
Well,
now I did have to do a lot of mental gymnastics to justify using drugs and working as a physician.
well,
Uh,
let's take one step back. So you take it, you it hits you. It's the best thing since sliced bread. Before we get to the 2 year mark, um, did did you have the beers as normal? Did you tell your wife you're taking the cough syrup instead of beers? Did she notice the change? How did you continue to get whether it's samples or the drug? Walk us through that because did your wife know? Because, if this was kind of a thing, like, hey, our Friday routine is we're going to have a couple beers. Well, hey, babe, I'm not having beers today. Well, something's different. But you still seem nice. So what are you on? Did she know? Wh-
No, she didn't know, and I didn't tell her. She did not even suspect anything was going on until after that 2 year mark when I was using it daily.
And
Um,
how are you getting
so
it? How are you keeping it?
how was that keep?
How are
Uh,
you getting it? Because you had the samples. So how did you and did it go from cough syrup samples to what? And how are you obtaining it?
so the cough medicine samples lasted well over a year. So they
Holy
would bring
cow.
samples, we would ride for it, they would bring more samples. So I sustained my habit purely from the cough medicine samples for about a year and a half.
Okay.
Um, but yeah, I never prescribed to myself. I never prescribed to friends and used theirs. I never prescribed to patients and used theirs. I never had doctors prescribe for me. And so I got it via samples. And then eventually it led to me taking, regular pain pills. And the way that I would attain that is that I would ask patients to bring in any leftover pain pills that they had after surgery, and then we could dispose of them properly. So, their 11-year-old wouldn't find these pills in the medicine cabinet looking for ibuprofen and
Right.
overdose. And so that practice of having my patients bring in their leftover pain medicine started from a legitimate reason, but ultimately that became my supply.
Okay. So you do this about 2 years. Where's the oh shit moment? Like, uh I got a problem. This needs to stop. Because you said, you ramped up slowly. You weren't necessarily, it took a little bit for the physiological. And for people who don't know, opiates, you get that physiological requirement or you go into withdrawal. Um, did you ever have any withdrawals while on the job? Did that ever become a problem? Because, yeah, when was the oh shit moment? I have a problem.
Yeah. So again, I'm going to refer to the fact that I was a responsible drug addict,
Mm-hmm.
meaning I could ration my supply over the weekend.
Okay.
And so I would get it directly from work during the week, ration it over the weekend. But there were definitely a few weekends where I would run out and I would start to feel the beginnings of withdrawals. That happen around year three maybe, and that's when I started to realize that I was in a deep hole. I was in some real trouble because I had tried to wean myself completely off a few times to no avail. And so I looked at myself in the mirror sometime around year three, and it was obvious that I was a full blown drug addict and that I was going to need to get help because there was no way I was going to be able to beat it on my own. I knew
And
that around year three, and that's also when my wife started to suspect that something was going on.
so how
Uh,
did that all come to fruition? The openness to the wife, the getting help. How did you seek it out? Did something happen that caused it, or was this voluntary?
Yeah, no, my partners found out in 2019, so this is year five, what I was doing, and I was fired right off the bat. And so I lost my job. That's and my wife had suspected it. We had talked about it. I had
Mhm.
admitted, yes, I'm addicted to these opiates. I had admitted that to her, but drastically downplayed the degree of my use and then lied to her about, hey, I was able to wean myself off. So a lot of manipulation, a lot of gaslighting, a lot of lying on my part, which is, that's part of the disease of addiction.
Addiction.
But it doesn't make it any easier for the receiver of all that stuff, which was my wife mostly.
No, and I don't know. I mean, I get it. I know people listening, it's probably hard to understand, but it's like people who become addicts, they don't set out to become that, and they don't, it's like you dedicate your life to helping people. Wasn't an intention, and the hurting's not intentional, but unfortunately, it's a byproduct of the disease.
Yeah. Yeah, it's truly a family disease. Everyone gets hurt. In my experience, at least, everyone that I knew or cared for got hurt.
So you got fired, and where does it go from here? Do you go to rehab? How do you and your wife, like, she comes to the realization, like, well, this is a big deal, and how do you deal with it upon the firing? What happens next, and how do you start digging yourself out of this?
So, we didn't tell a single soul that I was fired. But again, we were heavily involved in our community, and I had many, many, many patients of mine that came from that community. Um, and
So there's a
so
level of shame.
spread, and so yeah, my personal reputation took a big hit. My professional reputation took a big hit. COVID hits about 6 months after I was fired, and that brings in a whole. Everyone knows what that meant for the world. So I was fired in April of 2019. I didn't go to rehab until July of 2020, and that's primarily because the Texas Medical Board. I didn't have my meeting with them for 9 months after this happened, and so
Mm.
part of the requirement of keeping my license with the Texas Medical Board was to go to a 90-day treatment program, which is what I did. I picked one in northern Louisiana, and went to rehab for 3 months.
Is that like the TDAP? Or wait,
I don't know what it
I
is.
know we have I know I've had some dealt with nurses who um taking
Yeah,
stuff from the Pyxis, and they get, as long as they get the treatment, do the program, and there's specific rules and guidelines as set forth by whether it's the medical board, the nursing board, and whatnot, that allows you to continue to come back and, still be a professional in your chosen field, which I think is good. I mean, you know,
yeah, yes. I was part of a program that did that for physicians. It's very almost identical to the program for nurses.
okay.
And
How was the rehab experience? Because you said it took a little bit. Um, During that 9 months, um, okay, you get fired, there's COVID, you don't go to rehab for a while because of the whole time to meet with the medical board. Are you still using opiates, and how are you getting them for that time? Or did you get yourself off before you even went to rehab? Did you switch it out for drinking because you no longer had opiates? And because I'm understanding too, you lose a job. Um, there's shame and there's other things involved. And if you're already using substances, it would be easy to sub in alcohol, et cetera, et cetera. How did, what went on during that time between getting fired and entering rehab? What were you on when you went into rehab?
so, no, I lost my supply of the opiates when I got fired. So I went into immediate withdrawal and had to deal with that. You know, as a the first acute major consequence. That was not a fun 10 days. Um, but I would try to get opiates. If I went and visited, a family member or a
Hmm.
friend, I would dig through their medicine cabinets and try to get some. I would make up, why I was in pain, and my doctor would prescribe them to me. So very, very sparse
Yeah.
supply here and there, and not even enough supply to get to where I was physically dependent again. So I didn't have the withdrawals when I would use for 3, 4, 5 days at a time. So very sparse use in that 9 month period, and then COVID hit. Not because I was working a good recovery program, but because I didn't have a supply. It
Yeah.
never crossed my mind to go buy drugs on the street. Um, Rehab was a phenomenal experience for me. I loved it, but the counselors could not. They thought I was lying. They didn't believe me that I would never go to the street to get drugs. But that's the truth. It just never crossed my
Well,
mind.
that's the weird thing, is like you went to rehab, but how much were you actively using when you went to rehab? It's like, how much did you really have to kick because you'd already gone kind of through the withdrawal? I mean, because of the delay of, the medical board, the treatment and whatnot, you have that delay. So it's like if you're not a daily user when you enter rehab, what how is that experience different? Because it's not necessarily anything to kick. And that's why I asked, like, were you using alcohol as a substitute, or did you really have something to kick when you went into rehab, or was it just kind of a requirement to keep your license?
Um, well, so I'll answer your question a couple of ways. One is if you're on drugs or alcohol leading into rehab, they give you medication to help with the withdrawals for those 5, 7, 10 days.
Okay.
Only difference. The disease of addiction is about, poor coping mechanisms and stress management tools and the inability to feel a void in your life. So you're using drugs and alcohol as a solution. The actual drug or alcohol is almost inconsequential. So the experience of the rehab, um, minus those first 7 to 10 days, was exactly the same as if I had gone in there, using every day.
Yeah.
Um, but I was using when I entered rehab, I had been using for about 2 weeks straight,
Okay.
just out of circumstance, and it was enough to get some withdrawal symptoms when I went to rehab, but they weren't terrible, like
Yeah.
I had dealt with when I was initially fired. But yeah, rehab. I won't say that I had fun in rehab, but I hit the rehab with an inexplicable knowledge that I didn't know Jack SHIT
Mm-hmm.
about, which was my first dealing with my higher power having my best interest at heart. Because with the ego that I was floating those days, it doesn't make sense that I would do that. I would have thought that I knew how to do this, that no one could help me, that I knew the best way, but I did have the gift of willingness. I was willing to admit that I had a problem and that I was going to listen to these counselors in the rehab because they knew how to get me well and I didn't.
But it also puts you back in that cycle that you love so much of learning and kind of working towards something. And so I can imagine just the process of it alone opened up some of those dopamine receptors where you used to get that dopamine from, um, which I think is, I mean, hey, whatever it takes to get you there is good, you know? But that's kind of the parallel I can see is that that program kind of puts you back into something that was very rewarding for you before. And so it
You
made,
are you are exactly 100% correct. You are exactly right. I wanted to make an A+ in rehab. You
you know
know,
what? Starting a podcast, when my daughter said, when I quit drinking and started the podcast, I was like, I needed something to do, something to focus my efforts on. And I'd never had one. And it's like, well, setting up YouTube, setting up this, figuring out how to edit, all this stuff. It gave me somewhat a direction,
mhm.
which is all I needed. You
Yeah, yeah. And so, yeah, and you're right. I mean, I knew that I've known that, but the way you put it is exactly right. It was giving me the dopamine hit that I used to have back in school.
Yeah. And so,
But
so the biggest thing for you, since it wasn't necessarily about the physiologial part, were the what did you learn? You said you learned you didn't know much. Coming from a physician, what did you learn in the process of rehab, whether it's the group meetings, stress management tools?
yeah, so I learned, what I will call my character defects, which are all very similar for professionals who are addicts or alcoholics, like doctors, nurses, engineers, accountants, anything that has a formal training period and a state or federal governing board. Um, the character defects in those type A individuals are very similar. And so I was treated by a counselor who treated a lot of physicians. And I learned my character defects and I learned how to correct those. Now, actually correcting them, that's a different story, but at
Mhm.
least I learned about myself because it's hard to fix yourself if you don't know yourself. And I had to learn how to deal with life and how to deal with frustration and how to deal with all negative emotions with appropriate coping mechanisms as opposed to drugs or alcohol. That's what rehab attempted to teach me and did teach me. And then it was up to me to put that into practice in the real world.
Well, what's weird is I have this thought, um, this weird thought of like you, you're in college and you can drink. You you fail a test and you're like, oh, I'm a booze or something. Um, what I I've never had this thought, and so I'm trying to make the association of when you're this high achieving type A personality, we know this leads to this in adulthood, but when you were a kid and you had the same failures and setbacks, because you're not old enough to drink, use drugs or anything, how did you deal with it then? And did the way you deal with it as a kid and the way you learn to deal with it as an adult in rehab, are they similar? But it's like, why do we never? I mean, maybe as kids we throw tantrums, and I guess as an adult we can throw a tantrum, but we're not taking drugs or anything or trying to kill ourselves because of some frustration, which is almost what happens as an adult. So, yeah, I don't know. That's a weird thought is, we deal with some of the same frustrations as children, yet because we can't turn to drugs or alcohol, we don't. We just deal with it. And so it seems so foreign that we almost have to be taught as adults how to deal with challenges and frustrations without a crutch.
Yeah. And so, for example, one of my character defects was I had a pretty bad temper. Um, and so all a bad temper is emotional immaturity. And I also had a ridiculously low threshold for frustration. If I was going to learn something new and I didn't get it right off the bat, I didn't want any part of it. And so low tolerance for frustration and emotional immaturity, you ask the question and the answer is I threw tantrums. I had a bad temper. I mean, that's what a temper is. And so um, drugs and alcohol weren't an option. I didn't. It's hard to miss something that you've never experienced before.
Yeah.
You can't what you haven't had. And so I'm sure if I did have opiates at the time, there would have been a problem a lot
But
younger.
it's like, how do we learn that we think that that's the cure? It's not. I mean, we still as an adult suffer the same frustration and almost throw the same temper tantrum. The only difference is instead of carrying on normally like we would as a child and go play Nintendo, instead we go, I'm gonna have a drink or I'm gonna pop a pill and um, this is gonna make it better. It's I don't know, find it bananas in a way. I feel like I'm learning as we're talking, which is good. I'm excited about, um, because yeah, I have to admit, and I put it on an unfiltered Friday, is I lost my temper. I let things. It's been a while. I haven't lost my temper in that manner since I quit drinking, and I couldn't blame it on the alcohol, and I lost my cool, and it was frightening for those around me. Um, and I felt weak and horrible about it. And, my type of personality is coming from that environment. OCD perfectionist is like, you're not worthy of anything because you can't even control your temperature. And I mean your temper, and you're not even drinking. What the hell? And but also trying to go, I'm still human. I, it's better that I wasn't drinking. Nobody got hurt. You still have work to do. You still need to grow. Just because you've been off alcohol for 2 years doesn't mean that the OCD perfectionist, achievement oriented self that you were always praised for is not still tucked away in there.
Right. Yeah. And that need for external validation, another and perfectionism, two character defects of mine. You're exactly right. I have to learn uh, appropriate solutions for those everyday life issues. And when I say appropriate solutions, ones that don't include uh, a, a substance or a behavior that changes the way I feel. I have to learn, you know,
To sit in it.
sure, coping mechanisms, essentially.
Oh, it
Yeah,
sucks. I think sitting in it's the man, it blows. It's sitting in shame, and I'm trying to use it as an example, like with my daughter, to be like, sometimes men feel shame, and sometimes what we need, we want to isolate and run away, and it's not healthy. And sometimes all we need is the encouragement or love of a good woman to say, "Hey, it's okay. I still love you. Um, but you got to do better." And that grace, I'm like, can go a long way.
yeah,
And speaking of, um, you you do your rehab and whatnot. How does the family situation evolve as you come out of rehab? What steps do you take? How's your marriage, etc.?
yeah. So my wife was incredibly supportive during that entire time, and my kids, when I went to rehab, I believe they were 14 and 12. And so they were old enough that we could have a discussion and talked about it. And so my rehab recovery was AA based.
Hmm.
And so I was, treated with a lot of cognitive behavioral therapy, and psychotherapy in rehab, and also the AA program. And so when I came out, the entire family was supportive, and I jumped into AA again with both feet and just took it one day at a time.
How was the conversation with your children, and do you have any um other than at some point we're gonna tell people that they can contact you and use your coaching services, but any practical tip on discussions with teenagers, open, honest, transparent, lot, you know,
Yeah.
I always say they're little people. Don't treat them like they're stupid. Like my daughter, who's 11, even though when she was younger and I decided to stop drinking and she would sometimes ask me like, don't drink. I wanted to make sure like my wife and I are completely different and education level wise and understanding of things. And she would say, she's a child, don't whatever. And I'm like, she's a little person. I don't want to be condescending and treat her like she's stupid because then I'm going to be appeared as a liar because I was a very smart child and my parents hid things from me or didn't tell me everything. And when I finally found out, I felt like I'd been lied to and it created trust issues. And I never want to create trust issues with my daughter. So I'm maybe open and honest to a fault, but do you have any recommendations around that?
Yeah, I'll start by saying it's going to be kid specific. So,
Mhm.
parents, you know your kids better than anyone. And for example, my daughter, we didn't feel like she was old or mature enough to have a discussion about substance abuse. So we told her that I was going to learn how to become a better father.
Okay. Yeah. That,
And
that's the
then
truth.
Yeah, and then a couple of, as the years and months built up after that, we told her everything. My son, we told everything from the outset, and so he was 2 years older than my daughter, and so it's kid specific. But I will say, it's 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 the exception as opposed to the rule that being open and honest is the way to go. You know,
Yeah.
every now and then, if a kid is really not mature enough to handle it, it can come out sideways. But
Yeah.
in general, being open and honest is the best advice I could give.
Yeah. Well, my business coach will always say, like, the way I explain it to my daughter is you got to have clarity. Like, if the GPS in your car is broken, you'll drive off a cliff. With the truth, we have a better sense of clarity and we can determine the best treatment forward or how to move forward with the truth. I mean, it'd be like a medical diagnosis. I mean, if something's misdiagnosed, then you're treating it wrong. It's not going to get better.
Right.
But so you come out, you're supporting AA one day at a time. What happens next? Because I understand you're a physician coach, and um, I can see that your cancer diagnosis propelled you here, and now you end up with this, and hurt people, but also people who experience healing have an overwhelming desire to help others, especially um, around these kinds of things that are character and shame and whatnot. Um, what is the physician coaching? What happens and where do you get the idea, support, all that?
So let's rewind back to when I was fired in 2019. My license was going to be suspended for 1 year.
Mm-hmm.
Um, but that turned into 2.5 years because of the Texas Medical Board inefficiencies and COVID. So
Yeah.
both of those kind of combined to drag it out for 2.5 years. In the meantime, I had moved to Louisiana. So when I finally went back to work, it had been 4 years since April of 2019. And, we talk about challenges. Recovery is very, very difficult. Recovering from addiction or alcoholism is very difficult. For me, what was equally as difficult is the lack of fulfillment that I had without working for 4 years. It was
Mm.
just brutal. And so I went back to work. I signed a 1 year contract in March of 2023 and worked a year there. But my passion for clinical medicine had kind of faded away.
Mm-hmm.
I mean, I love my patients, I love the operating room, but it wasn't the same as it always had been. And so, just out of pure coincidence, someone I trained with in residency we were talking, and she's an ENT physician as well, and she was transitioning to become a physician coach for other surgeons who
Mm-hmm.
are struggling with things like imposter syndrome and doubting their abilities and burnout for some. But she recognized a lot of the language that I was using because it's all kind of cognitive behavioral therapy. It
Mm-hmm.
was recovery language to me, but to
Right.
her, coaching language. So the long and the short of it is that she said, "I think you'd be a good coach," and I agreed and decided that my niche was going to be physicians who were burned out. So I was the physician. I had burned out. I've experienced almost all negative consequences you can experience
Mm-hmm.
um, with that being the case. And essentially, I wanted to pay it forward, similar to the way that I wanted to pay it forward when I was a cancer survivor.
Man. Yeah. And so how does that happen? I mean, like I've been to these meetings where we do access meetings and you have like kind of physician coaches that coach other stuff or when the burnout topics come and all the big wigs come and pretend to care and offer something that's, it doesn't take off the patient load, the hours expected, the patients you're required to see. But yeah, it's funny. How does it? So I've seen it come in from like outside sources where the company might hire something, and to me, it's kind of like they're checking the box saying we did it, but it's not really helpful. How do you take shape? Is it private? Is it through a group? And how did you get into it, and how's it been working with people? What do you address?
So that's a lot. Let's see. Well, the answer to the first question is my services are offered online.
Okay.
So every time I meet with a client, it's on Zoom, and I have a website which is the burnout
Now,
doc.
did you leave the group and go, I'm starting a website doing this, and this is what I'm going to do, or like I'm going to continue kind of working in the physician capacity and do this in conjunction with?
No, I didn't start working toward coaching until my 1 year contract was up.
Okay.
So I didn't start it until March of 2024. And most of it was just researching and talking to this, her name is Mel, talking to Mel about how to launch
Mm-hmm.
business. And so a lot of it was building the website. And the hard part is getting your name out there as someone who does this sort of thing.
Yeah.
Because you're right. If you try to look for a coach and you're a burned out doctor, you're worrying about privacy issues. You're worrying about if the medical board finds out that you're being treated for mental health issues, could that have consequences as it relates to your license. Doctors do not, as a whole, doctors aren't lining up to ask for help.
No.
And so that's another obstacle. Very, very few physicians are going to want to go to another physician,
Hmm.
psychiatrist, and
It's almost
receive.
like an admission. Is the admission is like shame to admit
Yeah,
that. Well, because it goes back to this whole, it's all competition. You're almost admitting that I'm less than you or I'm not as good as you because I have to come to you or I have to ask you for help. And yeah, sure, I know I was the rock star in the operating room, but yeah, ugh, we
yeah,
have so screwed ourselves up.
yeah. And for some reason, and I don't really know the answer yet, but for some reason, a doctor will go to a coach um, and receive, treatment and therapy that's very, very similar to what a therapist or a psychiatrist would do. But because they're a coach, coaching it's almost kind of a cultural trend these days to have a
Yeah.
divorce coach, a love coach, a marriage coach. I hate to say trend because it's an excellent option.
No,
Uh,
I agree. I got two strategic and transformational coaching certificates. I needed something to work towards. And to me, it's like, well, if you're going to try to help people and, from the academic world, like you, I mean, I have a master's degree. It's like, this is saying I did something. If nothing else, I sat and did some work,
yeah.
which it might be more than the guru with beads on.
Well, and for my treatment is based around the fact that burnout is happening inside your head. There's a saying that trauma isn't what happens to someone, it's what happens inside someone. So it's your perspective, it's the spin that you put on life circumstances that leads to burnout. Um, and the actual treatment is cognitive behavioral therapy based, which is to say that our thoughts control our emotions and our emotions control our actions. And so, if we can learn how to control our thoughts, we can regulate our emotions such that we don't have helplessness and powerlessness and anxiety and depression and all these negative emotions that are requiring us to treat with poor coping mechanisms.
Actually, I have something. You said regulation. Um, and this is something I suspect of myself. And so I want to ask your thought on it. Um, is I never learned to co-regulate, which means I never learned to self-regulate. I never learned any of those because I was a high achieving kid. And I think when you're a high achieving child, people overlook everything. Nothing's wrong. Nothing could be wrong.
Yeah. And so,
And so it's like, well, you don't need to learn how to co-regulate because you kind of kept it all inside, or everything is, performance overshadows anything that you might lack or need emotionally. And so I think parents never teach it. It never comes up on the radar that, and this is why we end up as adults not being able to self-regulate.
yeah, it's again, I hate to tie everything back to it, but it really boils down to emotional immaturity. I like to tell people I was functioning with the emotional maturity of like a 16-year-old when I went to rehab. I mean, it was bad. I really had no ability to regulate my own emotions, and that included positive emotions and negative emotions. And so, how and where that was born out of, I'm not sure, but I think what you just described, almost certainly has a role to play.
Yeah. So you start coaching. How does the launch go and how's it been received?
Yeah, so physician burnout is an enormous problem. 53% of all physicians would qualify as being severely burned out. If you stop and think about it, that's scary, really.
Hey, when they did a report one time, we went to a leadership development and we would have these things and they would show like the most productive physicians and then Epic would show the report, the EMR, and they would show when physicians were charting and some of the top physicians, you see times outside of clinic hours, whether it's 1, 2 in the morning, 4 in the morning.
Right. Yeah. And so part of burnout um, is being overworked, not having enough hours in the day to do the work. That is certainly part of it. Um, all the bureaucratic tasks that
Growth. You need to grow. Your patient panel needs to be this big. If you're not growing, you're dying. But it's like you got 4,500 patients. Like that's too many. Like, you're seeing 20 something a day. Like, and administration would probably argue that you need to see more because you're not making any money till at least 18 pass through the door or something. So it's like the system does it.
yeah,
And that's part of why I didn't want to go back and contribute to it.
yeah. And another big issue is the entire existence of insurance companies. You have a third party that's essentially telling you as a physician how to treat your patients.
Well,
And
and they deny everything, which puts more pressure. Now the administrative people and that whole team is having to resubmit claims 3 or 4 times just to get a fraction of the payment for the hospital and the doctor. And yeah. Uh-oh.
you see me?
Yep. No, I hear you. I just see the B. There we go. Hold on. There you are. Perfect.
Okay. Sorry about that.
No worries. For a minute, I thought it was mine. I was interviewing somebody from Australia last night, and the power went out, and for a while, and it just went whoop, and it was funny because I was talking and I accidentally hit the mic, and you disappeared, and I was like, oh no, is it that? But yeah. So you were saying 53% of physicians are burned out,
Yeah.
and the insurance companies, nothing really. Nobody's, I think, contributing to solutions. And so you see this opportunity, and you mentioned launching. You mentioned that doctors do not necessarily want to go to doctors, and you had your friend Mel kind of talk about how you're going to launch this. How did you get it out there to kind of get the attention and trustworthiness of getting people to come to you, and then how has it been?
Yeah. And so what I saw is, like you said, this is a systemic problem. It's a systemic issue,
Hmm.
but I can't fix the system, and each individual doctor can't fix the symptom. So what are we going to do in the meantime? You know,
Manage.
so that's where coaching comes in, because ultimately, and again, this is the entire principle of how I coach. Um, our negative emotions and what we do and what we think, um, that comes from how we think, not life circumstances, not outside circumstances. So if you can learn how to control your own thoughts and emotions, you can eliminate most negative emotions, or at least the consequences that come from them, and burnout included. And so um, it's really effective because it changes your perspective on things. And again, most physicians, or let me put it this way, many physicians who are burned out struggle with similar things. And so that's how, we're able to kind of put together a protocol. But it's, to answer your question, it's been very difficult to get my name out there.
Hmm.
I mean, I have a website, I have a presence on Facebook and LinkedIn and Instagram, but there aren't a lot of doctors who are burned out who are also looking for help. So
I think it's probably the admission part.
yeah.
Like they're not willing to admit, and um I think the hard part is that um like if you were to compare it to Navy SEAL training, the residency and whatnot is so intense, and the amount of hours and whatnot that you work and the amount of effort you're required to put forth, that maybe being burned out doesn't seem like a legitimate problem. Like sometimes you could tell yourself, like, just stop being a vagina, suck it up. This is the protocol. This is the way medicine's always been. The harder you work, the more hours you work, the more alpha you are, yada yada yada. And I think it's kind of a cultural thing, and maybe the hard part is getting physicians to actually admit it, and um, or even treat your coaching like a weekly, biweekly therapy. The same way I have a business coach, but I also attend a book club. I'm also part of an online community. So when I feel like I'm melting down, when I lost my temper, it was all of these things that I was able to tap into to help me understand that your mind is telling you untruths.
Hmm. Yeah. Yeah. You're mentioning different resources. And, I tell my clients, you know, there's more than one way to treat what you're going through, burnout. Coaching
Mhm.
is just one of those ways. Now, in my opinion, it's the most tangible and significant way, because again, I'm not going to be able to decrease someone's workload. I'm not going to be able to make a physician's patients appreciate them more. I'm
Yeah.
trying to think of things that I'm hearing as problems. Um,
Patient
but
experience. Patient experience equals compliance, not when you have free will in the world and a system that's based on every 3 months you need this and that and blah, 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 blah.
yeah,
I always thought that that was the most interesting thing, is that we're nice to people because then they'll take their medicine, and then we'll spend, as a whole concept, we'll spend less money on healthcare because people will be healthier because they're happier with their doctor's experience. Well, one, we make it so you get 15 or 20 minutes. Um, he, it's impossible. It's just not true. Like, I think they need to come up with something else for better outcomes. Because I mean, the whole concept of medicine is the fact that we have the best technology, maybe some of the best doctors, but we don't live the longest. You
yeah.
know?
And one thing that I don't really hear spoken about a lot is that nobody wants to hear doctors complain, because the public's perception is that
Mm-hmm.
doctors are wealthy,
They got it made.
and happy and have achieved all their goals. And nobody wants to hear someone who they view as being very successful complain. And so and doctors feel that. And
Oh,
you're
and
not
they're
likely to
then they're
ask for
not going to
help
seek help. Yes.
from a public or from anyone who you think doesn't want to hear it.
Man,
So,
yeah, that's a very, very insightful, very enriching. And I get it because I remember when I was considering becoming a doctor, I read this old book called like A Surgeon's World, written by this old surgeon, and he talks about exactly this, of like, if you don't live in a certain house or drive a certain car, then you're not perceived as a successful doctor, and if you're not perceived, then the public doesn't want to go to you. And so that complaining thing of like, you don't want to go to a physician that you feel like has is a hot mess, but you fail to understand that they're human just like you, only they've been put through the ringer. Maybe they have some academic abilities and stuff that you don't have, but they've also been put through the ringer of a system that's kind of required that. And I think with a lot of things, um, what I feel at 49 years old, and I feel like we're starting to see that maybe some of the systems that we created long ago aren't really the best in terms of longevity as it relates to productivity. Because if you think about us as a society, we're all filling roles, we're all doing something. If the idea is quality, longevity, and better life, um, but our systems have become everything about capital and nothing about experiential and human and longevity, then we can't reconcile that until we stop making it about money and start making it about humanity, the human experience, and whatnot.
Yeah. And it just reminded me, I'm not a big fan of the saying, "Oh, it sounds like that's a first world problem," as if the only problem you're allowed to have is if you're homeless and starving in West Africa and you don't know where your next meal is going to come from. Anything less than that, and I don't want to hear it. That's just not valid.
No.
Uh, and so that entire attitude that our culture has is not helpful for anyone who is perhaps dealing with some mental health struggles.
So, taking this journey, I always love to ask people as we wrap it up, what is it's man, you've had some struggle, you've done some work, it's been a challenging journey. What's one unexpected benefit that has been a blessing that maybe you never would have saw coming had this not happened?
Uh, I can think of a couple. One is that I've gotten a lot closer with my parents and with my dad especially. So I would have never envisioned our relationship becoming as close as it has been over the last 4 years. So that's been an unexpected perk. Um, on more of a general sense, I now think about living in the present. So what I should have done in back in 2017 when I was on top of the world and I had a successful practice and a healthy family, and again, I should have stopped and smelled the roses. Well, now I do that. And so
Mhm.
I enjoy the process of everything. I try to live in the present. That has also been an unexpected perk of, you know,
Well,
poor choices that I've made.
where can people find you and what do you hope for the future?
So, best way to find me is my website, which is theburnoutdoc.com.
And that'll be in the show notes.
Yeah. And so you can get me there. And then what I envision is hopefully, because burnout is going to become such a problem that I think the ACGME and the regulating bodies that govern residency training is going to start requiring that programs have coaches to help with burnout
Hmm.
and to help acknowledge and root out who is burned out, who isn't, who needs treatment. So I love to be involved with treating residents and kind of getting to the heart of burnout in a more of a preventative way as
Yeah,
opposed.
well, because that creates that longevity that I was talking about, that you're getting them at a impressionable age, almost like an athlete, and going, hey, if you want to maintain this career and have a good, long, successful career, this is, these are the things we need to start doing now. And you need to understand like this about this, whether it's the profession, the mindset, the cyclical things of achievement, and what we as individuals get from that in that career field, because you're that type of person, that type of thinker. And so I think that would be an awesome thing if, you're kind of become one of the first people or help pioneer maybe something with a system fix. that makes it better long term because let's face it, we need more doctors and nurses. People aren't signing up to do it. And it's hard. And I once worked I worked with a doctor who's from Jamaica, and he goes, "Richard, when white men stop going into the profession, it's a problem. There's no money to be made if first world white men aren't willing to pursue it." So, which is a
Hmm.
very interesting concept from a third world, person. And that's why he became a doctor. And so, um, yeah, I think once the system identifies it, and is willing to do something about it, man, that could be a huge opportunity, and the credibility you would have coming from that because of the lived experience, and you know, to go, hey, this can very easily be you. You have the same qualities as me. That's what got you here. That's
Right.
why you're here. Um, so understand that just because it's never you until it's you. I have an episode on that because, my grandfather went missing for like 18 hours. We were treated as suspects, and, it's never you until it's you. So,
Hmm.
but, well, I appreciate you spending your time with me. Do you have
Absolutely.
any questions for me or anything you want to leave the audience with?
Um, no, just take care of yourself. And, I've been asked if I could give one piece of advice to someone, what would it be? And those who are in the recovery world, it's, everything is done one day at a time. Um, but something else out of that world that I like to tell people is when in doubt, just do the next right thing.
I always say, I go, every time you open your mouth, you have an opportunity to put something good in, something bad in, something bad or good can come out of it too. Every time you open it.
Yeah,
So read the room, and I love that. Do the next right thing. Um, because oftentimes our impulsive brain wants to do the not next right thing.
that's right. In fact, most of the time for me.
Me too. Guilty as charged. But that's exactly why I wanted you on here. And I was so excited to get to talk to you today because this is in my wheelhouse, as 2 years of no alcohol and a reformed healthcare manager.
It's great.
But
Great.
all right, as I like to tell everybody, we end the episode with go out and be the person that you would want to meet.
I like it.
All right. See you. And I
Thanks.
will let you know when everything's going to come out. All right.
Okay. Thanks, Richard.
All right. Bye bye.
Let go.
Asteroid of fear.